Hi everyone, welcome back to the second video of the lecture. In this video, we will discuss in depth about the diabetes mellitus. The first type of diabetes mellitus known as type 1 diabetes mellitus. This type 1 diabetes caused by the pancreas unable to produce the insulin due to disruptions of beta cells in the pancreatic islet. This insulin deficiency will cause no glucose uptake by the muscle cells and adipose tissue. It also may cause the liver to continue producing glucose, which leads to high glucose level in the blood. This disease usually managed to detect during our childhood year. Type 1 diabetes is further subdivided into immune-mediated or known as type 1A and idiopathic or unknown cause also known as type 1B. The immune-mediated form is the most common form of type 1 diabetes. As you can see here, latent autoimmune diabetes in adults, or also known as LADA, is a form of type 1 diabetes that develops later into adulthood. LADA tends to develop more slowly than type 1 diabetes in childhood. And because LADA can sometimes appear similar to type 2 diabetes, doctors may mistakenly diagnose LADA as type 2 diabetes. Most of the patients with type 1 diabetes have one or more circulating antibodies such as glutamic acid decarboxylase or known as GAD-L65, insulin autoantibody tyrosine phosphatase IA2 or known as ICA512, and zinc transporter 8 or zinc T8. This can be detected in the time of diagnosis. These autoantibodies will destroy the beta cells of islet Langerhans by autoimmune response of the macrophage, T cells, and cytokines. The detection of this antibodies marker facilitates the diagnosis of type 1 diabetes. It also can be used to screen family members at risk for developing of these diseases. There are two main factors for the type 2 diabetes, which are the beta cell produce less insulin or insulin resistance happen on the skeletal muscle, adipose tissue, as well as in the liver. This will induce the hyperglycemia. Older patients, especially obesity, are high tendency to develop the type 2 diabetes mellitus. Patients with type 2 diabetes can initially be controlled with diet, exercise, and oral glucose lowering agents or non-insulin injectables. However, if the condition is uncontrollable or they do not seek for any medical treatment, it will lead to progressive beta cell failure and eventually they need the insulin therapy. The gestational diabetes mellitus, or known as GDM, is defined as any abnormality in glucose level that can be noted for the first time during pregnancy. Last trimester of pregnancy, the placenta and placenta hormones such as estrogen, cortisol, and human placental lactogen can create an insulin resistance. In this slide, we will discuss the role of HbA1c and blood glucose level. The blood glucose level can be measured through preprandial, postprandial, or HbA1c. The preprandial means before a meal. You might have heard the words in the context of preprandial plasma glucose or PPG. This refers to your blood sugar level before a meal that must be between 4.4 to 7.0. They need to fast at least 6 hours to get the glucose level. Besides that, the word postprandial means after meal. So means that it refers to plasma glucose concentration after post 2 hour eating, which in the range must be between 4.4 to 8.5 millimole per liter. HbA1c should not be more than 6.5%. Patient that was diagnosed as diabetes must have at least more than one occasion after 8 hours of fasting in which the fasting plasma glucose level must higher than 7 millimole per liter. As I mentioned before, the normal range of fasting plasma glucose for healthy adults should be within 4.4 to 7 millimole per liter. Oral glucose tolerance tests also can be done, which the patient should eat nothing after midnight prior to test day. On the morning of the test day, adults are given about 75 grams glucose in 300 ml of water. For the pregnant woman, is given them 100 grams in 300 milliliter of water. And the children were given 1.75 grams of glucose per kilogram of ideal body weight. The glucose should be consumed within 5 minutes. The blood sample for plasma glucose are obtained before and after 2-hour ingestion of glucose. An oral glucose this OGTT test is normal if the fasting venous plasma glucose level is less than 5.6 millimole per liter and the post 2-hour value falls below 7.8 millimole per liter. A fasting value of more than 7.0 millimole per liter or higher, or 2-hour value of greater than 11.1 millimole per liter is diagnosed as diabetes mellitus. Meanwhile, patients within this 2-hour value in between range of 7.8 to 11.1 millimole per liter have impaired glucose tolerance. Hemoglobin A1C, often abbreviated by HbA1c, is a form of hemoglobin, which is a blood pigment that carries oxygen that is bound to glucose. HbA1c, also known as glycosylated or glycated hemoglobin, and can be lost in our body up to 3 months. Means that this HbA1c test is an indicator to show the average level of blood sugar over the past 2 to 3 months. Healthy HbA1c levels are less than 5.3 and diabetic patient has more than 6.5% of it. Why HbA1c measurement is important? It is because every 1% reduction in HbA1c can reduce the risk by 21% in the diabetes-related death. It also can reduce the risk about 14% of myocardial infarction, 37% in the microvascular complication, and can reduce the risk of amputation or death about 43%. In patients who do not monitor their glucose levels regularly, HbA1c measurements are essential for adjusting the treatment. The preprandial and postprandial blood glucose level can be self-monitoring. These self-monitoring blood glucose, or known as SMBG, are crucial for those who receive the insulin therapy. The checkup must be done minimum twice daily or before any injection of insulin. If these patients tend to develop hypoglycemia or not achieve the A1C target, they are required to monitor the postprandial blood glucose and sometimes in the middle of the night.